first of all, we identify where the hernia is, what type of hernia it is. We look for other hernias. For example, very commonly, I will have a patient referred to me with an umbilical hernia, and I'll do a further exam and find out that they have an inguinal hernia as well. Well, we fix inguinal hernias through the belly button. So you don't want to fix an umbilical hernia and not diagnose the inguinal hernia, because you could do both sides, both inguinal hernias and the umbilical hernia, through the same incision. So first of all, you need to rule out hernias in other locations. I had a patient last week that had bilateral inguinal hernias that went undiagnosed but was referred for an umbilical hernia. When we went to do a surgery, we just made an incision underneath the belly button, and we fixed all 3 hernias through that same incision. So we saved him a subsequent operation down the road. Once we identify what type of hernia the patient has and rule out other hernias, then we look at other comorbidities. We look at the patient's weight, the patient's BMI, the patient's overall health, and you tailor the repair toward that patient. And we talked about that earlier in terms of, some operations you can do and not even require general anesthetic. So if the patient's young and healthy, and you can do it minimally invasively, that's generally the route we go. We'll do laparoscopic inguinal or a laparoscopic incisional, depending on where the hernia is. But if there are other things to consider, we'll sometimes switch gears and do an old-fashioned open repair under local with IV sedation.